Hey, good afternoon, good evening, good morning, whatever time you're watching this. This is Rob with the 411, and we are back with the 411 for 719 podcast after a bit of a hiatus. And I am honored to be in the presence of Dr. Knies from Rose Injectables as our first podcast back on the flow here. Dr. Knies, hey, thanks for being here.
Absolutely. Thanks for having me.
Well, thank you, and thanks for supporting the 411. So, tell me a little bit about yourself and what you do.
Yeah, so I'm originally from Colorado. I grew up between Colorado Springs and Wetmore, so on the way up to Westcliff out on a ranch. And I left for about 20 years to train in medicine and worked in a lot of different facilities in big cities, Atlanta and Houston and San Antonio, and spent some time in South America. And then made my way back after 20 years to come back and work initially in a family business and then started my own.
Right on. And what? Tell me, what is Rose Injectables?
So Rose Injectables is it's kind of funny. It started as a joke, actually. I had my last child. She was a few months old, and I'd been asked in Canyon City to offer Botox for a long time. And I trained in aesthetics in 2013, and I was like, we could do it, but I couldn't imagine Canyon City would be that busy. So we just planned to do 2 days a month. We opened up in a 8 by 12 room next door to a junkyard, like nothing fancy or busy or anything like that, and it started to take off pretty quick. And then that was January 2020. So then we shut down in March for COVID. And being some of the things that I perform are essential, then we did reopen this so we could take care of some patients that were ill or things like that while I was working alongside the hospital. And it just started getting busier. But in June of 2020, our youngest child at 9 months of age was diagnosed with cancer. And so it
Oh,
sort of changed everything overnight with what we were going to do. So her cancer was extremely rare, 1 in 10 million, and no one really sees it or treats it. And so we ended up taking her to St. Jude in Memphis, Tennessee. And she went there initially to have her cancer removed. And then when we got back, we really sat down to think about what kind of parents we were going to be and how we were going to navigate this because we have 7 kids, and having an ill toddler, what we were going to do. And so we looked at the business and, saw such a need for advancements in women's healthcare. It's just, after a woman has children, they sort of become more invisible in medicine and there aren't great treatments. We look at men as they're aging, and Viagra, for example, has been covered by insurance for 27 years. And there's just no advancements like that for women, or they're more archaic in style. And a lot of women are just missing that there's amazing treatments out there to make them feel better, look better, age better, just not be confused, brain fog, energy, all of that stuff. It all exists. And there's even ways for women to be able to lose weight who have struggled forever that weren't around before. And so that's where we niche in. We fit in our office now, where we've expanded between a med spa and a plastic surgery office. So anywhere from skincare, weight loss, hormones, Botox, Dysport, all the way up to in-office awake liposuction. So we kind of cover the basis. And so when we had been open for 5 years, by the way, our daughter's doing great. She ended up having stage 4 cancer, chemo, the whole nine. So we celebrate her every September for Pediatric Cancer Awareness Month. So that's always a big month and a big deal for us. She's currently the ambassador for Signet Jewelers, so Zales, Jared, Kay, Piercing Pagoda. So if you were
wow.
at Chapel Hills Mall, Citadel, or any of their establishments, you'll see her picture there, and you can buy holiday bears around the holidays with her photo that she named too. But
That's incredible.
yeah, at 5 years, we said, our daughter's doing great. She's thriving, doing amazing. And we have this business that sort of came out of nowhere that shouldn't have even existed and shouldn't have come from such a small town in Canyon City. And so we looked at, where did we want to be in 10 years? And most small businesses don't make it 10 years. And we said, in order to do this, I think it's important for us to open an office in Colorado Springs. So I've worked in Colorado Springs before. My father was actually the founder of the Emergent Care urgent care clinics back in the 80s. He was sort of a pioneer in medicine, as one of the first board certified ER doctors in the US, and really wanted to fight for patients to have affordable care and get quality care like an emergency room, but you could get what you need in an urgent care a lot of the time. So I worked with him in those for years between Colorado Springs and Pueblo. And so we bring that sort of house call feel to our office here. but just a different approach. I think that medicine needs to change. I think it's been broken for a long time. And I think women need to demand more in their providers, in the time that they get, the understanding of what's going on with them. And I feel like I am one of those women too. So I have a good understanding of what women are going through, and we strive to provide that. So I'm sitting right now in our consult room. This is where we bring in our patients in our Colorado Springs office to come chat with us. So it's not a sterile white box. It's really meant to be more of an experience and thoughtful for the women that come in. We see men too, but definitely it's really tailored for women coming in.
That's pretty incredible. From one of the marketing things we talk about a lot, but this I don't like the label that I was going with on that from a human perspective. A lot of what works, why the 411 works, is because there's a human there to help. We're awash in information and we're in data. I'm a big data guy, but we have so much information. It's hard to parse. So relating that to what you're doing, there's so much information in healthcare, but there's a human aspect that is not being addressed. There's the human aspect of technology, the human aspect of medicine, the woman aspect of medicine. There's almost like a homogenization, to my mind, across the board that's happened. My daughters and I recently went on a road trip, and I was struck by the idea that every place we went through looked pretty similar in terms of restaurants and things. There was a Starbucks, not knocking Starbucks, but there was a Starbucks every 15 miles, right? And I hope I'm relating this correctly, but I think what you've hit on is I'm going to bust up the homogenization and address a real pain point, human pain point that exists. Kudos to you, Doc. That's awesome.
I think that's really, I tell people all the time, like, we've got to disrupt things, and it's a prime time for that, because COVID created a distrust of medicine in a lot of ways. Different aspects came through, and I personally just went through things where I went to my own provider's office, and I don't tell anybody I'm a physician. I really want to know the patient experience and what everybody is going through when they seek care. And I've received the runaround when I call from a front office where it's hard to get in or hard to get answers, and almost like gatekeepers where I can't reach the provider. And then when I've gone in, it almost felt like nobody cared after I'd had kids. Like, nobody spent time to ask me, hey, if you cough or you sneeze, do you leak a little bit now that your pelvic floor has changed after kids? Do you have energy to stay up and put your kids to bed at night? Or do you feel so depleted and exhausted, you feel like you can't imagine how you're going to make it through this stage? And I hear the stories from women all the time. They're just told, you're just getting older. Like, this is part of aging, and it's just not real. That just isn't where things exist. And the same thing, you get into weight loss, women have heard forever, they just don't have enough willpower. If they just didn't have that cookie or a glass of wine or whatever it is, they could be successful. But we know that's not it, because the studies are not really done on women. And so we don't have a great understanding of what's going on with them. And this day and age, I think women really, they live in that fight or flight response. They're going all the time in that sympathetic response, and cortisol's through the roof. And until somebody addresses, how do we take them out of that fight or flight sympathetic response and allow their body to move into the parasympathetic and rest and digest phase, they can't lose weight. And so we get to address all those things. And, I just find so much joy in helping women get through, because I've probably been through almost every single thing. I was a Weight Watchers lifetime member after college. So I've been through weight loss struggles. After my last child couldn't lose weight when she was diagnosed with cancer and chemo. And so to be able to find solutions that are novel, niche, that we can make work with everyday people is really who we are. And that's what I want to be, is just an approachable place. I'm not a doctor behind a white coat that you get for 5 minutes while I breeze in and out. Like, I'm here to be your friend. I've been there, and I want patients to know, like, there's true connection available. And there's people you can see and talk to, and someone to listen to you with a stethoscope that will actually put their hand on you. And that just doesn't always exist these days.
That's profound. It mirrors a lot of the thoughts I have about systems and things. I'm a big systems guy, and however, I temper that with the following quote: humans are not computationally irreducible. right? We can't. I think I think that's echoing what you're saying from a data nerd kind of point of view. The book says, but okay, the book is not the human, right? There's I don't even know how many cells we have, but about 10 billion possible permutations and combinations, right? I'm reminded. I was telling a story about an Air Force colonel yesterday, John Boyd, and he was a maverick of his day in the Air Force, and he would tell the Air Force, "Hey, these aircraft are more capable than we think they are." And the Air Force would say, "No, they aren't. The engineer wrote in the book the aircraft can do this," and he would say, "I'm not an engineer. I'm a pilot, right? And I'm telling you, the aircraft can do more." I hope that is resonating with kind of what you're saying. What I'm hearing you say is humans are not the book. And you're bringing a human approach to
Yeah.
women's health.
Yeah, there's so much more out there and so many more possibilities for women to feel normal, to feel like they did in their 20s or 30s. And it isn't like you get past a certain age and nothing exists for you. Like there's real treatment and there's crazy alternatives to surgery and everything else that really exist that most women just don't even know about. And we're small. So I work hard to just be a squeaky wheel and from the grassroots effort, spread the word. But in just Canyon City, so population of about 15,000, we were able to bring in patients from 15 states and 3 countries. We were nationally ranked, so top 1% of a med spa across the US. For my signature treatment that I offer is called the Perky Peach, which is our trademark treatment for women's health and pelvic floor. We were number 1 in the United States. And for Morpheus 8, which is like a collagen, we were number 1 Colorado and top 5 in the US. So I'm not only, I tell everybody what we do, it's not just to be good enough for good enough for Colorado Springs. It's got to be so good that anybody from anywhere in the world could come in and say, it's the best experience I've ever had. And that was the type of doctor's office I wish existed everywhere. And we would just create that and hope others will do better.
Well, I think that's phenomenal. I think that's phenomenal. He kind of blew my mind with the ramifications, and I'm definitely going to follow up with you and see how the 411 can help support this mission. I would suggest get in there and tell your story here in the thread when I post this. Also, tell that story. Use this platform to tell that story, and let's help some people.
Yeah,
and let's help some women. Yeah.
Well, and I'll tell you, just I've been a member of the 411 for 719 for years, probably. How long has it been in existence now, Rob?
Oh, probably 10 years. I'd have to check, but I think we just went across this year, the 10-year birthday.
Yeah, probably since the very beginning. I've been a part of it because I've been back here in Colorado since about 2014. And I've been a part of it. And it's where I go to for my trusted info because it's so hard to cut through,
The noise.
whatever's out there these days. And, for myself, I don't watch the news anymore. I get my information quickly and concisely from people just giving me quick feedback, and I can make a quick decision on where I'm going and who I'm trusting. And it's up to date, it's timely, and it's probably one of the most valuable resources I've seen for people. And even in my office, I tend to interact quite a bit online and try to help people either ask more in-depth questions to get a more educated answer for what they're trying to achieve, or just to kind of give people hope. Like there are options out there that you can find things. And the 411 has brought so many people already. People come in here all the time and I'm like, how'd you hear about us? And 411 for 719. And so I just so appreciate what you've done because you bring community together, and that's what people need. And I think COVID created such a divide and people stayed home and we don't have those connections the same way. But this is a way that people can connect and really learn and spread the word about offerings that exist that otherwise could take years for people to find answers to their questions or their problems too. So I'm just so appreciative for what you've done here.
Well, thank you in turn. I try. The 411 exists to hold space. Is kind of what I say to the moderators a lot. Is when we have these discussions about, and we have extended discussions about what are we doing and why are we doing it. And I was just talking to somebody yesterday about what's where's this going? Well, it doesn't necessarily have to go anywhere. I don't have an end state in mind. We're holding space for these very conversations, and the act of holding space. I'm sure some folks hearing this are going to roll their eyes when they hear me say this, because I say it a lot. But the very act of holding space is the service we provide, and for that very reason, why does it exist? It exists for what you just said. Why do I get up in the morning and do these things? It's to amplify the signal through the noise. I'm a former radio guy from the Air Force. It's 20 years in the Air Force, and so the signal to noise ratio is always on my mind. How do we cut through the noise? And that's a systems perspective too. How do you reduce the noise? How do you reduce the entropy in a system, and allow signals like yours, Dr. Knies, to cut through that noise and tell that story? So thank you. Thanks for doing this with me. I look forward to helping amplify your signal, and also seeing your messaging, and helping promote that messaging too. I usually wrap up with a fun question or two. Let me ask you first. I'm going to throw a curveball at you here. If you could go transport yourself any time and any place in the history of the world, where and when would you go?
That's a good question. What's coming to mind right now is, because you're talking about radio, back in the day in college, I was in Atlanta and I was a radio DJ too.
Okay.
So I've had a lot of
go back and do some scratching there.
Yeah, getting to interact with people and everything. I thought it was a blast.
That would be fun. Okay. One more. Favorite book or a book recommendation that you would offer to the members of the 411.
I think the book that's changing minds and changing lives right now, that I really hold to so much esteem for women getting a better understanding. I actually have it here too. The book is called Great Sex Never Gets Old. It's a clever title, but what it does is it brings a conversation about women and aging and hormones and what's happening. I'm trained in Western medicine. I went to University of Texas in San Antonio, and I learned medicine the typical way everybody does. And I can tell you that we're not taught how to help women and people age differently and with hormones, and how to address different things, and what it means when your testosterone falls below 30 or 20, and what your vitamin D means. So I love this book. As such an easy read. You can get it on Amazon. We give it away to our patients when they come in. We don't charge for our initial consult. You often leave with gifts of different things, because I want to educate. I think that's the most important part, is for women to know what's there, what's available, how they can get help, so that they're not just relegated to living a life that they're wondering, wow, is this as good as it gets? And why do men have all the fun?
Fair enough. I know they say you're not supposed to introduce new information at the end of a segment, but you actually bring up something that I read about, and I'm interested, as a medical doctor, what your opinion on this is. And I read about this thing called the Cartesian split. And back a couple hundred years ago, Western medicine separated itself from holistic Eastern medicine. And we went down one path. Well, other parts of the world went down a holistic path. And what I'm hearing you, if my interpretation and understanding is correctly, is you're bridging that gap. There's you're Western medicine trained, but you're acknowledging that there's a whole holistic part of all of this too. Am I right, or did I mischaracterize that?
I had a lot of resistance to it for a long time. And then when my daughter was stage 4 cancer, and we had her in the hospital, the odds of her survival were less than 5%. Like, no child with stage 4 cancer in the studies had survived what she was going to go through. And at that moment, I was like, well, then why wouldn't we do everything? Right? Like, why wouldn't I bring in a functional medicine provider at the same time to work in conjunction with my doctors? Like, her odds are awful. We've got to do whatever we can. And I think that's an important part of medicine now, is not being so closed off, because I was that way. And I can see it now, where I lost the ability to take in new information. And it could have been a cockiness too, because I think, hey, I trained this way and I have so much knowledge, and I've seen all these things, and I've worked at the craziest of crazy hospitals. But I think we have to keep that curiosity and wanting more knowledge to be able to do things. I mean, I would love at some point to bring in biohacking where we're doing genetic testing here, and then I can tailor supplements directly to you that are going to take care of exactly what you're needing, and that we can give you a plan for what you should be eating that would fit your specific genetics the best. Like, I see so many advances coming that we can tap into and bring here. And I think this market would be great because we have such healthy people and active people with the Olympic Training Center and these athletes around us, and people that want to live their best life, but they're taking it under their own control now. They're not going through the normal paths they used to because they realize the system's broken, insurance is broken, you're just limited.
Yes. Yeah. I think there's a lot going on, and that's a whole another hour-long segment to unpack what you just said. But yeah, we're seeing the system is broken, and from insurance to expertise and what that means, and people's available access to information. There are some folks, I'll try to link some in this in the thread here, that are talking about the information revolution, if you will, where our access to information is changing the paradigm. AI is changing the paradigm, right? The ability. I saw this quote the other day, and I just love it. Right, AI has taken we used to consume information. Now we can have a conversation with that information. Anybody can have a conversation with that information. And what does that mean for expertise? What does that mean for all the things? So fascinating. And it sounds like you're on the cutting edge of this from a medicine and holistic and biohacking and gene checking perspective. That's pretty incredible. I was also reading about active inference AI the other day, which could take everything you're saying and take it another step further. So super cool, super fascinating that I thank you. Thanks for being a member of the 411. Thanks for supporting this idea. Thanks for being here this morning. How can we get a hold of you?
So our website, roseinjectables.com, you can go there. Patients can see all schedule openings and book directly there for our Canyon City or our Colorado Springs office. They can call our number, 719-924-4424. I've got YouTube channel with lots of educational videos, our social media, Instagram and Facebook. So Instagram at Rose Injectables MD. Tons of just content where I try hard to spend time on the education so that you can understand what's there in small segments. And then when you want to come in, just schedule. There's no obligation. I'm not here to push anybody to do anything. The question is, where are you right now, and what would make you feel and live your best life, and how can I help? And for some people, it's just sharing. And then others say, hey, I'm ready for the next step. If people need labs, we draw them in-house. So I try hard to not send you around everywhere. We even keep in-house pharmacy for some of the things our patients need so that they're not having to run all around town. We want things to be convenient. So we've taken a lot from my experience in emergency care, urgent cares, and how that system ran to bring that feel. And really, like house calls, this is a personalized experience. And I've learned from some old school docs back in the day, and that's what we want for our patients, is to get back to the humanity in medicine and to really feel like people care. You're not a number.
That's a great thing to end on. You are not a number. And folks, if you need some assistance, if you're a woman in need of some medical care, please reach out to Dr. Knies, and we'll be in touch. Thanks for being here.
Rob, I really appreciate all you do. Thank you.
Oh, thank you. Thank you in turn. 411, I'll drop her contact information in the links, and I'll talk to you soon.